Hello, my name is Leah Christie and I'm a student nurse at the University of South Alabama. Today I'll be performing a central line dressing change. So now I'm going to have her scan my room. And first I'm going to verify the patient care order form as well as the hospital policy. I'm going to perform hand hygiene upon entering the room and identify my patient using two identifiers. I'm going to be using the armband and the patient care order form. So I see Jaguar Jones, date of birth 08/25/1963, date of birth 08/25/1963. I see that he has an allergy to penicillin, which is also on the armband. And now I'm going to gather all of my equipment and I'm going to explain the procedure to the patient, provide patient privacy, and I'm going to assess and palpate through the tegaderm, and I'm going to be looking for any thing that would make a culture indicated, such as an infection that would cause oozing or drainage or odor. And then I'm going to make sure that my bedside table is at my waist level and that it's closest to the central line so that I can keep all my supplies sterile. I'm going to position my trash can, perform hand hygiene, and then I'm going to raise the bed to working height, lower the side rails, and position the patient comfortably, making the head of the bed slightly elevated. And then I'm going to open up my kit, making sure that I just open up the first flap so that I can don my mask. For the sake of the video, I'm going to keep my mask a little down so that you can hear me. And then I would don my my goggles, sorry, and then I would assist my patient in donning their mask, and then I would put on my clean gloves. And now I'm going to remove the tegaderm, making sure that I stabilize the catheter with one hand, and then I am going to pull the tegaderm toward the insertion site on all the sides, and then I'm going to dispose of that in the trash and take off the bio patch and dispose of it as well. Now I'm going to take off my clean gloves and I'm going to assess and look for the catheter as well as the site appearance and the surrounding skin. If there were any signs and symptoms of complications and a culture needed to be indicated, I would do that now. And now I'm going to perform hand hygiene. I'm going to open my kit using sterile technique. So I'm going to be opening it just by the flaps. And I'm going to make sure that I only touch the 1-inch border. And now I'm going to don my sterile gloves. I'm just going to be touching the flaps to open my sterile gloves, and I'm going to make sure that I only touch the 1-inch border. And I'm going to pinch this glove and put it on, and then put my fingers with my thumb away. And now that I have my gloves on, I'm going to keep my hands above my waist at all times to avoid contamination. And I'm going to organize my supplies, keeping them well away from the 1-inch border. And now I'm going to stabilize the catheter using one hand, and since I touched it with this hand, that hand is contaminated. So I'm going to take my alcohol swab and I'm going to be going in circular rainbow motions from the site outwards, making bigger circles as I go out so that I'm not going over the same spot twice. I'm going to do this for about 30 seconds, and then after I do so, I'm going to dispose, and I'm going to grab my ChloraPrep and I'm going to activate it with the wings. And then once I do that, I'm going to clean vigorously, going in vertical and horizontal motions, also cleaning the catheter while I'm still stabilizing the catheter. And I'm going to do this for at least 30 seconds, and then I'm going to dispose and I'm going to let it dry completely, and then I'm going to apply my bio patch. So when I do this, I'm going to apply it with just this hand, and making sure that my gloves do not touch the patient. And now I'm going to grab my Tegaderm and I'm going to open it. And since my hand is contaminated, usually this would not fall on the 1-inch border because that would make it contaminated. I'm just going to be touching the paper parts of the Tegaderm, making sure that I don't touch the sterile part. And then I'm going to, I would dispose of that, making sure my hands were above my waist. And now I'm going to apply the Tegaderm with the insertion site in the middle. I'm going to make sure that it's smooth and that all of the edges are adhered correctly. And then I'm going to take off the wrapping of the Tegaderm. Sorry, it's just taking me a little longer because I have my sterile gloves on. Normally I would be able to remove the entire wrapping, and then I would take off and dispose of my sterile gloves using glove to glove and skin to skin technique. And then I'm going to dispose of my mask as well as the patient's mask, and I'm going to take off my goggles. And then I would make a label with the date, time, and initials, and I would put it on the Tegaderm, making sure that it's not covering the insertion site. I would put it right here, the label is right there. I would have just took it off the other wrapping, and then I'm going to lower the bed to the lowest setting and raise the side rails. I'm going to position the patient comfortably, making sure that the call light is in reach, and then I'm going to dispose of all of my equipment, and I'm going to perform hand hygiene, and now I'm going to document. I'm going to be documenting for the site appearance, the drainage amount, the characteristics, as well as if a culture was indicated, the type of cleanser, the type of dressing that was applied, the patient's tolerance, as well as the date, time, and my initials. Thank you.